Hello everyone, here I'll discuss about the features of suprarenal gland and parathyroid gland. This section includes its position, features, blood supply and function. Coming to this first figure, that is the anterior view of this posterior abdominal wall. Superiorly can see this diaphragm. Medially there is the inferior vena cava, abdominal aorta. Here can see this branches from the abdominal aorta, terminal divisions, that is the right and left common iliac arteries. Then see this right kidney. It's a right aspect. This left kidney with the suprarenal glands, right and left suprarenal glands through the upper pole of this kidney. Here, that's the posterior abdominal wall muscles are there. So these are paired endocrine glands which lies on the posterior abdominal wall on this upper pole of the kidney. See the shape of this right suprarenal, that is triangular. This is right kidney with suprarenal. This is the left kidney with this left suprarenal. Left suprarenal, that shape, that is the semilunar in shape. Then here is the anterior view. The right kidney with right suprarenal adrenal gland, left kidney with this left suprarenal gland. Okay, its dimensions, that is the length is 5 centimeter, its breadth, that is 3 centimeter, and its thickness, that is 8 millimeter. Then its weight average, that is 5 grams. Okay, it is retroperitoneal. Then this right one, the features, it has a base towards this upper pole. This is the upper pole of kidney. This is the apex. Okay, it's pointed, which lies behind this inferior vena cava. Then there is a lateral border and medial border. Medial border and this apex lies behind this to this inferior vena cava that forms the anterolations. The left suprarenal has an upper end. This is the lower end. See, this is the medial border and this one is the lateral border. See the surface here, this is the anterior surface. Posteriorly behind that there is the posterior surface. Here the coverings of this suprarenal, there is a false capsule and true capsule. Okay, this is the sagittal view. Here this is the posterior aspect, this is the anterior aspect. So kidney, its coverings from inner to outer, renal capsule, perinephric fat, then there is the renal fascia. Posteriorly can see this is the paranephric fat. So the renal fascia covers the anterior and posterior surfaces. Then superiorly in the upper pole, it fuses. Then it splits to enclose the suprarenal gland. Then again it fuses at the apical region. From there it forms the suspensory ligament of the suprarenal gland and attached to this diaphragmatic fascia, this diaphragm. Okay. So that renal fascia forms the false capsule. Inner to the false capsule, there will be the condensation of the fibrous storm of the gland forms the true capsule. So there is true capsule, false capsule. Here the relations, this is the anterior view. Here you can see this is the right kidney with right suprarenal gland. Here there is the left kidney. Here we'll get there is the left suprarenal gland there. Then here this can see the duodenum, pancreas, the stomach, the body and pylorus is cut. Here spleen can see, medial can see the inferior vena cava. See the abdominal aorta, celiac trunk branches there. Okay, so transverse colon can see. So this one, right suprarenal gland, anteriorly relates to this inferior vena cava, and here in the right side there is the liver there, and so there is the right lobe of the liver anteriorly. Posteriorly, here it relates to this right side, that is the diaphragm, right part of the diaphragm. The left suprarenal gland anteriorly, it lies behind the stomach and this body of the pancreas. Okay. So that is the stomach, less sac, then body of the pancreas that forms the anterolations. Posteriorly we'll get that is the left side of this diaphragm. Then medially, here medially there is the celiac plexus there. Then also there is one artery from this abdominal aorta, that is the inferior phrenic artery. This forms the medial relations with this inferior vena cava and this abdominal aorta. Then here there is a blood supply. Here the arteries, here see the abdominal aorta, see this is the vein, this is the inferior vena cava. From the abdominal aorta superiorly, you can see this is the right and left inferior phrenic arteries. It is providing superior suprarenal artery. This is the middle suprarenal artery, that is the direct branch from the abdominal aorta. So this renal artery, right and left, here it's providing the inferior suprarenal arteries. Okay. So there is a superior suprarenal artery, middle suprarenal and inferior suprarenal arteries. Superior suprarenal, that is from this inferior phrenic artery. Middle suprarenal, these are the direct branches. Inferior suprarenal, that is from the renal arteries of the respective sides. Then venous drainage, here the right side, see this is the right suprarenal vein drains into the inferior vena cava. See the left side, there is the left suprarenal vein or adrenal vein drains into the left renal vein. Okay. So this veins and this lymphatics leave the adrenal gland through the hilum. Then this arteries and nerves enter the gland through various sites. Okay. So it's lymphatic drainage, that is to the lumbar nodes, nerve supply, that is sympathetic from this T10 to L1 segments, from T10 to L1 segments of this spinal cord. Then here, seeing the second figure, that is the anterior view of the posterior abdominal wall. See this is the inferior vena cava medial abdominal aorta. Then this is the right and left common iliac arteries, right kidney with the right suprarenal gland, left kidney with the left suprarenal gland. See the shape of this right suprarenal, okay, right one. See this the enlarged image. See here the right can see clear, right one. Here there is the inferior vena cava, they reflected towards the left side. Okay, here it's behind this inferior vena cava. This is the apex and medial border of the right suprarenal. The left one, that is hemilunar. See this hilum, can see the renal vein behind that is the renal arteries there. Okay, see the muscle here, this is the psoas major, posterior abdominal wall, psoas major. Then here this is the quadratus lumborum. So diaphragm, can see diaphragm. So the suprarenal gland, it consists of one, there is an outer cortex and there is an inner medulla. This cortex is larger, this is the inner part, that is medulla, which secretes this epinephrine and norepinephrine. The cortex produces the steroid hormones. Okay, so these two parts differ in embryological origin, structure and function. That's all about the suprarenal gland. Then here there is the parathyroid gland. So this is a posterior view through this thyroid gland. Okay, this is the posterior view. Here this is the right aspect, left one. See this is the right and left lobes of the thyroid gland. The posterior border, you can see these nodular yellowish structures. These are the parathyroid gland, which lies inside the thyroid capsule. Okay. See the lateral sides, you can see this artery, this is the common carotid, divides into external, internal carotid arteries. This is the internal jugular vein. See here, this is the branches from the arch of aorta. This is the brachiocephalic, right common carotid, right subclavian. This is the left common carotid, left subclavian there. Then middle of this vessels laterally, there is the vagus nerve. It is providing, this is a right recurrent laryngeal nerve. Here you can see here, this is the left recurrent laryngeal nerve. So here the superior parathyroid gland, inferior parathyroid gland. Superior parathyroid lies in this middle of this posterior border. Inferior parathyroid gland is locates near to the lower pole of this lobe of the thyroid gland. See this artery is coming here. See the superior thyroid artery from this external carotid artery. It is providing parathyroid branches to the superior parathyroid artery. Superior parathyroid gland. See here, this is the inferior thyroid artery. It is providing inferior parathyroid branches to this inferior parathyroid gland. Then here, this figure, this is also the posterior view. Here, this is the lobe of this thyroid gland, that is the right and left lobes, posterior border. There you can see the superior and inferior parathyroid glands. This is the inferior constrictor of this pharynx. This is the esophagus, you can see here. See here, this is the common carotid internal jugular vein, and this is the vagus nerve, superior thyroid artery, inferior thyroid artery. So its dimensions, that is the length is 6 mm, then breadth is average 4 mm, then thickness that is 2 mm. Okay, weight that is 50 mg. Okay. Then nerve supply, that is sympathetic through the superior and middle cervical ganglion. Okay. The function of this parathyroid gland, it secretes parathormone, which maintains the blood calcium levels. So the secretory activities of the gland are controlled by the blood calcium levels. Low calcium levels stimulate secretions. High levels of calcium inhibits the secretions. Okay. Additional to that, it maintains the calcium metabolism by enhancing the mobilization of calcium from bonds by this osteoclastic activity, increasing the reabsorption of calcium by from this through the proximal renal tubules, then also promoting the absorption of dietary calcium from intestines. Okay. Then the superior parathyroid gland develops from the fourth pharyngeal pouch, hence it is called the parathyroid 4. Inferior parathyroid, that is develops from this third pharyngeal pouch, hence called the parathyroid 3. Okay. That's all about the features of this parathyroid gland. These all glands, this suprarenal, these are endocrine glands, so they are highly vascular. Okay. Now we can answer this, that is the differentiate the right and left suprarenal gland. There is a difference between this right and left suprarenal gland. That's all.